For this video, I'm going to be explaining pulse point locations. The easiest way to do it, in my opinion, is to start at the top and work your way down. So we're going to start with the temporal. The temporal pulse point is located on the temple side of the forehead, right above the zygomatic arch, near the outer campus of the eye. Right there. Next pulse point is the carotid. The carotid is located in the neck, in between the trachea and the sternal-mastoid muscle, right in the middle. So you're gonna take your fingers and palpate, and you should feel a nice strong pulse. The apical pulse cannot be palpated and needs to be heard with a stethoscope. In order to do this, first you'll start at your sternal notch, which is right here, right below the laryngeal prominence. You'll take your two fingers and trace down your chest wall until you feel a ridge. This is the second intercostal space. Next, you'll take your other hand and place it on the mid-clavicular and trace down the left side of the chest wall until you're at that second intercostal space. You'll bring your fingers together, so right there. But you need to go down to the fifth intercostal space, so you're gonna count 1, 2, 3. This is where you'll place your stethoscope in order to listen to the apical pulse. When finding a patient's brachial pulse, you'll want to make sure that they extend their elbow so that it's nice and flat, and then making sure that their palm is up so that you can feel on this side of their arm. What you're going to do is place your fingers on the outer aspect of the inner elbow towards the body. And after palpating, you'll be able to feel it. The radial pulse is in the wrist at the radius. So what you're gonna do is you'll find that radial bone on the thumb side of the hand, and you'll go just to the right of it. You'll feel it. The femoral pulse site is one of the deepest sites in the body. You must push deeply in order to feel it. Where you'll find that is right at the top of your thigh, where it meets your groin. So right in there. Next is the popliteal pulse, which is located behind the knee. After making sure that your patient is either seated with their legs bent like I am or laying down with their knees bent up, you're going to take your thumbs and place it on the front portion of the knee. It's a little bit backwards because I'm doing it on myself, but we're gonna go like so. And then you're gonna take your hands and cup them around and push deeply. This is another one of those pulses that's pretty deep, so you have to push kind of hard to feel it. The final pulse point is the dorsalis pedis, which is at the dorsum of the foot or right at the top. If you have your patient extend their big toe out and up, you'll see the EHL tendon. You can use this as a landmark to feel your pulse, but after having the patient relax their foot again.